Hello and welcome to Caregiver 101, presented by James Care for Life. In today's program, we will discuss the basics of what it means to be a caregiver when someone is facing cancer. This will include common issues that caregivers encounter, caregiver tips, and available resources. It's my pleasure to introduce our presenter. Annie Trance is a master's trained clinical social worker at the Ohio State Comprehensive Cancer Center, Arthur G. James Cancer Center, and Richard J. Solove Research Institute. She has experience in providing psychotherapy, support, advocacy, and referrals for cancer survivors and caregivers. She currently provides outpatient counseling, as well as support to cancer patients, their families, and caregivers in the survivorship clinic. She also provides support and programming to the James community through James Care for Life programming. I'll turn it over to our presenter. Thank you.
Hi, thank you, Chelsea. Well, we here at the James really recognize that cancer is a family disease, that it impacts not just the patient, but everybody in their life. So I'm really happy to have this program tonight to specifically highlight caregiving and to provide some support and some tips into how we can support you as you walk alongside your loved one in the cancer journey. So Chelsea highlighted a few of our objectives, but I'm going to go over them again. We're going to talk a little bit about who caregivers are and the role that they play. We're going to discuss some common challenges that caregivers encounter, identify the signs of caregiver burden. We're going to talk a little bit about that and some stress management tips, and also identify some tips and resources to help ease the role of caregiving. So I want to talk about the numbers first. So the most recent numbers through the American Cancer Society is that there's an estimation that there's 14.5 million cancer survivors, and it's estimated that by year 2024, there'll be 19 million. And this is largely due to earlier treatments or earlier detection and better treatments. So people are living long lives with cancer. And what strikes me about those numbers is that those are pretty high numbers, and it makes you stop and think about how many caregivers does that represent. Oftentimes, caregivers are family members, and 83% of caregivers who are polled identify as a family member. Some other numbers: caregivers provide 75 to 80% of care. That's really, really high. And that adds up to about 8.8 hours of care a day, which, think about that, that's a full-time job. And 70% of caregivers report also being in the workforce. So those caregivers who are working jobs are also coming home and still providing, another full-time job of care. And on average, about 4 years of caregiving. So who are caregivers? It's really anybody who provides a level of emotional, physical, or practical support to somebody experiencing cancer. Caregivers are a vital part of the healthcare team, and they play a really important role in improving the patient's health and their treatment, and also with the caregiver's or the patient's quality of life. 60% of caregivers are female, and on average, looking at about 49 years old. The caregiving that we're talking about tonight is informal caregiving. So it's unpaid, not trained for the caregiver job. And it's reported that about 1 in 3 caregivers have no additional help, either hired help or unpaid help. So the role of caregivers, as we talk about caregiving in the context of cancer, the roles and tasks and responsibilities really change throughout the various stages of cancer survivorship. So during diagnosis, the roles and the challenges that a caregiver may provide are, the emotional coping of dealing with the initial shock of dealing with a cancer diagnosis and gathering information to understand the diagnosis and the treatment options that are available. And then some of those roles and responsibilities may shift to something different during treatment. Maybe at that time, the primary responsibility is getting to the treatments, helping your loved one tolerate the treatments, dealing with the side effects that they may be experiencing during treatment. And then moving into post-treatment and long-term survivorship, this is a phase where oftentimes it signifies that we should be celebrating, that we made it through treatment, that the tough part is behind us. And what we know is that's not really always the case, that post-cancer is when folks oftentimes are struggling with some long-term side effects of their treatments, maybe some physical changes that they've experienced because of their type of cancer or the treatments that they've had. Sometimes the emotional coping doesn't settle in until after you've gone through treatment. And so the role of the caregiver kind of shifts and is focused on still supporting the cancer patient much beyond the treatments. And then roles also shift too with cancer recurrence. Sometimes there's a lot more emotional coping and support that happens at that point, and making decisions about what to do with treatments, with different recommendations, and then also with palliative care and end of life, roles also shift and decisions change at that time as well. So what do caregivers do? You all know what you do, and this is just a snapshot of things that caregivers manage and provide. Just kind of threw up some major ones. Company to medical appointments, providing support with the day-to-day needs, managing medical problems, dealing with finances, dealing with insurance claims, communicating with oncology team. A lot of times the caregivers are kind of at the front line with reporting symptoms or changes in their loved ones' coping or physical care, maintaining home and doing laundry and running errands, and also while doing all of this stuff while managing the needs of other people within the family. So whether that's extended family or children or parents, caregiving continues. The one thing that struck me too is that increasingly caregivers are providing care that nurses used to typically provide. A lot of care is done now in the home. So that's with injections, maybe that's managing tube feeds or managing a catheter or colostomy care. These are all things that, if you're not a nurse, a trained nurse, can be very overwhelming and scary. So it kind of strikes me that, we're throwing family members and caregivers into these roles. Everybody experiences their caregiver and cancer journey differently, but there are some common issues that caregivers report to struggle with, and some challenges that they're faced with. One of those is isolation. I think oftentimes the focus of care is really on the patient, and so everyone's kind of rallying around the person with cancer, and medical teams are really focused on treating the cancer and the person who is sick. And as a caregiver, you also have your own needs, and so it can feel a little bit isolating in that role. Oftentimes, too, caregivers are the ones who are giving up their social life or things that they used to do to stay connected to other people, which can further feel very isolating. Difficulty asking for or accepting help. I oftentimes hear caregivers say that, they feel it's their responsibility, and they feel guilty if they are asking someone else to do a job that they feel responsible for. And so that can further create some isolation and some problems. Role changes is a big one. When a family or a couple, when somebody is faced with serious illness like cancer, oftentimes that person is too sick to do the things that they're used to doing. So there's a lot of role changes. Maybe the person who is sick was the one who took care of the finances and no longer is at a point where they feel well enough to do that. Well, somebody takes over that role, and oftentimes the caregiver is the one taking on all of the additional roles and shifts. We talked a little bit about neglecting personal needs. That's a pretty big one. I oftentimes see caregivers who are so focused on caring for the person who is sick that they forget. They either forget or they just don't make it a priority to take care of themselves. That, the crisis is sort of the person who is ill, and that's the major focus. Health concerns, family challenges, and of course, stress is a big one. With all of these things that we're talking about, it can really impact the stress level. So, common caregiver needs, and talking about the issues that oftentimes caregivers encounter. There's also some needs that caregivers are reporting to need more information or need more assistance. One of that is information about cancer, medications, and treatments. It's very overwhelming to be faced with a diagnosis like cancer. And if you're not in a healthcare background, it's like learning a new language. And even if you are in healthcare, if you're not specifically in oncology, it's very daunting to, read what's being told to you and read the treatment options and all the information that's out there. So it can be a lot for someone to take on. Help with financial issues and insurance coverage. I think this is one of the major stressors is dealing with insurance is never easy. But when it comes to cancer and all of the treatments that you may need and the medical appointments and specialists that you're seeing, it can be very overwhelming to know what's covered and what's not. And, I think this is an area that caregivers really report that a need for more assistance managing and understanding some of those problems. Help communicating with medical professionals, some legal advice, learning care tasks, and addressing transitions in care at different times throughout treatment or the cancer journey. There may be transitions, maybe rehab is needed. Maybe a treatment isn't working and you're faced with making a decision about what to do next. These are all different transitions, and it's hard to navigate that as a caregiver and as a family together. Help with addressing end-of-life issues, advice moving a loved one onto a facility, and also kind of help dealing with the family. So because cancer is a family disease, it's impacting everybody in your life. So as a caregiver, you may be more attuned to that, but it's also likely having an impact on the children or the grandchildren or the siblings that exist as well. I'm going to talk a little briefly about caregiver burden because I think this is important. Because of all of the challenges that we've been talking about, it can really open you up to a lot of stress. And when it's not managed well, it can open you up to what's called caregiver burden. So the definition of caregiver burden is the extent to which caregivers perceive that caregiving has had an adverse effect on their emotional, social, financial, physical, and spiritual functioning. So it's kind of a long definition, but basically the important pieces of this is that it's multidimensional, that it's crossing all different areas of stress in your life and of problems in your life, and that it's also highly individualized. So what may be very stressful for one person may not be for somebody else, that how this plays out for somebody is different. And this is something that's frequently overlooked by healthcare clinicians. And this is, as we talked about, the focus really is often on the cancer patient. And though we recognize caregivers are a vital part of that, we have a long way to go to really include caregiver assessment and interventions as part of routine care as well. So with that being said, the National Consensus Development Conference for Caregiver Assessment has recommended assessment that we need to be taking caregivers' needs and interventions more seriously and as a part of our healthcare practice. And so this is something that I'm constantly looking out for in my practice with patients and with families, is paying attention to knowing really who are the vital members of care. So when I'm seeing a patient, who else is with you? Who's your primary sources of support? Who's bringing you to your appointments? And incorporating really the needs of both the patient and the caregiver. It's not going to work if we're scheduling appointments on a day that doesn't work for your caregiver if you rely upon your caregiver to bring you to those appointments. So it's important that we as healthcare professionals are really looking at, the support network in a person's life and taking all of those needs and those preferences into account as we make plans for care. And also recognizing that we need to be checking in with caregivers and hopefully having you report to us more than once that this should be happening throughout the cancer journey. We talked about the different phases of cancer survivorship. Well, as a caregiver, your needs change throughout that cancer journey too. So we need to kind of constantly be following up and checking in to see how you're coping and how you're feeling capable in your role as a caregiver. And it's important too that we're paying attention to your own well-being and your confidence in your ability to provide care. That we need to ask the caregivers too, what are you doing to take care of yourself? What's the kind of support do you have in your life for yourself? These are important because when you're doing well, that's going to have a positive effect on the person that you're caring for. The American Cancer Society has a caregiver self-assessment questionnaire on the website. And I didn't pull it up, but I would encourage you to look that up because I think that as a caregiver, it's important for you to start to recognize what your own needs are and kind of weigh out really how you're coping with the stress in your life, given the demands that caregiving provides. And what this is it kind of leads you through a questionnaire and then you tally it up and then there's recommendations based upon where you come out of that questionnaire. So I like to hand it out every now and then and just say, hey, maybe just take a look at this. Just assess, see where you're at, just give it some thought. So some signs of caregiver burden. So it's really, when you think about it, when you're feeling completely overwhelmed and stressed, it just kind of leads to this feeling of physical exhaustion, of just feeling really depleted. Oftentimes there's some guilt when taking time for yourself. I hear that a lot of guilt wrapped up with caregiving. Maybe some resentment. Feeling a little bit more critical or irritable, having a difficult time laughing or just kind of enjoying the good things in life, that's becoming a little bit more of a struggle. Feeling trapped, feeling like you don't have a choice. This can also play out with changes in your sleeping patterns, not exercising, not engaging in hobbies that you used to do to take care of yourself. Feeling unappreciated, and that's kind of linked in too with the resentment that, sometimes you might resent the role that you're having to play, that you're forced into to fulfilling at the time. And then also just some low mood, feeling down, depressed, or increase in worry, and maybe even experiencing some anxiety. So you may feel a couple of these at any different time, at various times throughout the cancer journey. I think the important thing to pay attention to is when you're feeling a lot of these. When you're feeling a lot of these and it's happening at the same time, that these should really be red flags. Like, hey, whoa, we need to kind of pump the brakes for a minute and check in with ourselves to see what's going on. Maybe we need to make some changes in our life or get some additional help. Maybe we need some professional help. So they're really just things to pay attention to. Some risk factors for caregiver burden. So I put these on here, not because these are cause and effect. Certainly, if you fall into one of these categories, it does not mean that you will experience caregiver burden. But there are things that research has shown us can leave you susceptible, can make you feel a little bit more vulnerable to caregiver burden. And one of those things is being female. I think the role that our society places on female as sort of being the juggling act, the primary nurturer, that has a factor. Low educational attainment, residing with care recipient. This one, that's a big one, because when you're living with the person that you care for, what that tells me is that there's no break, that there's no opportunity to step away from the situation. And that can really increase the risk for feeling very overstressed. Higher number of hours spent caregiving, that's sometimes linked in with living with the person who has cancer. Depression, social isolation, financial distress, and lack of choice in being a caregiver. So some implications of caregiver burden. The first one's kind of scary. Research has shown us that caregivers are at a 63% increased risk of mortality when you're experiencing high levels of caregiver burnout that's untreated and that does not go away. Weight loss, poor self-care, sleep deprivation, depression, anxiety, social isolation, and even suicide. So these are sort of the scary things. We put them up there to show you how important it is that we are paying attention to the needs that caregivers had, because this stuff can be very frightening. So with all the problems that we talked about, what helps? What helps deal with all of the stress that you experience as a caregiver? Well, one of the things is really we're going to talk about ways to reduce the amount of stress that you experience. This slide kind of hits a lot of different things, a lot of different coping strategies. And it's just really to take a look at what has worked for you to cope with stress in the past. What has worked that maybe you stopped doing? What do you need to put back into your life? Or what are you doing that isn't working? Maybe it's time to start something new. So we're going to kind of breeze through some of these things, but really it's about finding coping strategies that are individualized and that work for you. Because caregivers often put their own needs aside, and the first thing to really go is kind of your physical health, it's important that we're looking at the ways to cope physically, because stress has a physical impact on our body. And so it's important that you're looking at, getting enough sleep, getting some physical activity, getting some exercise, and eating nutritious meals and eating regularly. And following up with your own medical care or your own dental care. I think these are sometimes the first things to go for somebody when they're focused on someone else's health and medical care. But these things are really important to keep your body, functioning properly and moving forward. The other thing is that when we're stressed, we are triggering our body's internal fight or flight system. So that happens when we are feeling threatened, when we are perceiving a threat, whether that's an external threat or an internal threat, like a worry or something about the future. But our body kind of ramps up during that time. Your heart may quicken, you might feel shortness of breath, the oxygen in your body is kind of flowing to large muscle groups, kind of preparing your body to fight, kind of stay and fight, or to flee and to run. So with chronic worry and stress and anxiety, is that this can have really lasting effects on our physical health. And so it's important to counter that process within our body and to train our bodies to exhibit our relaxation internal system. And we do that by practicing. And if you're not used to doing it, it does take some practice, but it's really important that you're finding ways to relax. So that may be through meditation, diaphragmatic breathing, which is really just slow, deep breaths, breathing in through your diaphragm. So not the short chest breathing, but in through your belly. Progressive muscle relaxation. Sometimes we don't even know that we're feeling stress or tense until we actually start to pay attention, and then you thought, oh wow, my shoulders are a little tight. And when you pay attention to it, you can kind of then also pay attention to relaxing your shoulders. So flexing and releasing large muscle groups kind of helps your body notice that change in sensation and work on that relaxation stage. Guided imagery, trying something new, yoga, massage, and really the bottom line is, again, it's just finding something that works for you, because relaxation is a large part of countering stress. So we're going to move into a little bit of addressing some emotional ways of how you can help reduce some of the stress in your life. And one of those is through problem versus emotion-focused coping. When we're feeling stressed and overwhelmed, it's sometimes hard to even stop and identify what the primary problem is. Sometimes we just get caught up in all of the problems and all of the stress that we're overlooking really what is the problem. So with this model it's looking at the stress in your life or the problems and identifying what is the problem, what is the source of stress right now that I'm encountering. So maybe the problem is that you've got your loved one has chemo all day tomorrow and there's nobody to pick up the kids from school. Well, using this model, you look through and say, well, can I change it? No, I need to be with my partner who's getting chemo. Okay, if I can't change it, can I change it? Yes, I can change it, because then I can try to start to identify who else can pick up the kids. Is now a good time to work on it? Yeah, because it's tomorrow. So now is a good time. Do I have the resources to work on it? So it's sort of looking at, identifying who would I call to help me in this moment. And so that's following down through the problem-focused coping. Sometimes, though, there are problems that don't have an easy solution. And in that case, we're looking at more emotion-focused coping. So that may be finding ways to cope with the feelings that are arising out of maybe living with uncertainty or not having control over completely changing the problem. So this slide kind of breaks down some examples of what problem-focused coping looks like in what emotion-focused coping looks like. So part of identifying the problem is problem solving. So that may lead you to get organized. Maybe it's time management, and it's forcing you to look at your schedule differently. Assertive communication to manage stressors. So it's equipping you to take action, to do something about the problem. versus emotion-focused coping, which is, again, looking at, I don't have total control over this. And a lot of times that leads to more worry and sometimes anxiety. And so it's looking at, how do I cope with this? Maybe it's distraction. And I think that's a really big one, is finding ways to, healthy ways to distract. So that could be going to a movie or going on a walk or drinking a cup of coffee with a friend, getting the emotional support that you need. Practicing relaxation. Mindfulness is part of relaxation. Mindfulness is a type of intervention that helps you to really focus on the present. So much of stress and worry is future-oriented. Well, mindfulness kind of counters that to, how do I focus on the present, on the here and the now? What are my thoughts and my feelings? Kind of looking at it without any expectations or judgment. And there's lots of mindfulness resources out there, and we can talk about that a little bit later. Problem solving, which is, a coping skill as part of coping with the problem versus emotion focused coping. And again, when we're feeling really overwhelmed and stressed, we're oftentimes not thinking very clearly. And it's very easy for folks to get stuck in one of these steps. And when you look at this, it seems so simple. Like, oh yeah, problem solving. This makes total sense. I do this. But if you stop and think about it, when you're feeling overwhelmed, oftentimes you're stuck somewhere in this process. So it may be that you're not identifying the true problem. Or sometimes I see folks a lot get stuck in the brainstorming. So it's sort of like, we're going to identify all these things we could do, but we're not going to actually implement a plan on carrying it out. So it's important to pay attention to this, because this is a way to, there's so many problems in the cancer journey. And problem solving is, I think, vital to coping and getting through the cancer journey together. So I would encourage you to use this model and to pay attention to it. So some other ways to cope emotionally. The slide that says, today I am grateful for. This I like because practicing gratitude is such a powerful way to cope with problems in your life. When you're dealing with really serious illness like cancer, it's very scary, and it can be very easy to get caught up into everything that's going wrong and to focus on all of the negative parts of how cancer is impacting your life. But when we're able to sit back and really look at, what am I grateful for? What is going well in my life? What am I proud of in my life right now? And looking also at, what do I have to look forward to? These are powerful things that can help shift perspective. So the problems don't go away, but how you perceive the problem can change. And so, I encourage folks to really pay attention to gratitude and to practice gratitude in their life. And that may be easier for some than others. And so it takes some practice. And, ways to do that is, through writing or journaling. Sometimes people really connect gratitude also to their spirituality or to their faiths, finding ways to nurture that. And it may just be kind of at the end of the day or when you wake up, just take some moments and sit and think about the things that you're grateful for. And this other quote I also really like, and it's by Brené Brown. And if you're not familiar with her, she's a really great researcher and social worker who does a lot of writing on vulnerability and the gifts of imperfection, and about being kind to yourself and cherishing yourself. So she's a good writer, and she does a good TED Talk on some of this as well. But this quote that says, "Talk to yourself like you would to someone you love," I feel like this was said for caregivers, because so much of what you do is to talk kindly and gently and supportively to the person that you're caring for. And you need to do that to yourself. It's, again, when you're feeling overwhelmed and stressed, you sometimes focus on the things that are going wrong and you internalize those things. So practice some self-love, some gentleness, talking to yourself in positive ways. So I'm just going to kind of briefly talk about this next one. So cognitive behavioral therapy. This is an evidence-based therapy approach, and there's lots of information out there. There's a lot of self-taught interventions with cognitive behavioral therapy that you can look into. It's oftentimes used in psychotherapy with clinicians kind of guiding you through some of this stuff. But basically, the idea behind cognitive behavioral therapy is that our thoughts and our feelings and our behavior are all connected. So when you're intervening on one level, that it's going to have a ripple effect and change some other things. And so it's empirically supported to treat a wide range of clinical problems that include some of these listed here: anxiety, insomnia, depression, eating disorders, and chronic pain. And I put this up here for caregivers because so much of a lot of the things that caregivers are experiencing are related to stress, are related to worry, and we get stuck in that process. And so this is an intervention that can kind of help reframe and restructure maybe some of the thoughts that you're having. Just because I have the thought doesn't make it real, kind of testing out, is there another way to look at this problem? So some things like that. And if you're interested, I can give you some resources or some professionals also who provide this type of therapy for your own use. Also, so some healthy coping we talked a little bit about relaxation and the importance of that. And James Care for Life does classes with relaxation and mindfulness and some meditation. And also OSU Integrative Medicine, the website is there. They have a lot of great resources online that can kind of guide you through guided imagery and just some mindfulness practices. So that's something to pay attention to as well. And also James Psychosocial Oncology. So that is the department at the James that provides counseling and support to cancer patients and their families that are having a difficult time coping with the challenges and the impact that cancer is having on their life. So if you feel like you need some additional professional support, well, we have a department here for that. So looking now at coping and hitting some social needs that you may have, it's important that caregivers are getting support. And it doesn't have to be a wide range of people and networks, but you do need it. So whether that's family or friends, neighbors, maybe a faith community, maybe clergy that you trust and have a good relationship with, it's important that you're seeking out people to get the support that you need. And it's also, you need to maintain some normalcy in your life, the things that you find enjoyable. So maybe that's going out to dinner with a friend or going for a bike ride. It's important that the things you did before cancer entered your life, that you're still finding time to engage in those things now. And it doesn't have to be long periods of time. You can find little moments here and there to fit into your day to engage in. You just actually have to do it. And that's part of the time management and organizational skills that we touched upon. And maybe you need to try something new. There are support groups that are available to you. James Care for Life, our support groups are open to cancer patients and caregivers. There are also some caregiver-specific support groups that we're going to get to in a little bit. And respite, delegate, allow others to help. This is a really big one. I think that when you're feeling really overwhelmed and stressed, oftentimes we're taking it all on ourselves. We're not doing enough to get the help and to delegate things that need to be done. So pay attention to who's in your life. Who can you pull in? You know, it doesn't have to be the same person for everything. People in your life all have different skill sets and interests. So kind of identifying who's good at what and pull in that network of people. Looking at spirituality, there's a lot of definitions of spirituality out there, but this is one that I particularly like. The definition reads, spirituality is the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they experience their connectedness to the moment, to self, to others, to nature, and to the significant or sacred. And this is a big one, and I think that people sometimes get confused with spirituality, and if they have bad experiences with religion, they kind of lump the two together, but they are different things. Spirituality goes beyond religion. It's really more about the thoughts and the feelings and the experiences of being human and the meaning that we are attributing to things in our life. And when we're faced with challenges and difficult periods in our life, and illness being one of those, is that it can really offer the opportunity for meaning and growth. It can also present some distress. You know, maybe you're experiencing a lot of questions and concerns and the not understanding why something is happening in your life like cancer. So it's important that we're paying attention to those questions, because finding ways to work through some of that and to nurture those things are ways that we can really help ourselves grow and cope with difficult things. So now we're kind of going to shift into looking at some practical things that can support and help you in your role in caregiving. And one of the things is really knowing, as you're a patient of the James, is knowing who your treatment team is. There are so many folks involved in your care and some behind the scenes. It's important to know who everybody is so that you really know how to navigate your questions and your concerns too. Oftentimes I hear people tell me down the road, like, wow, I didn't even know this existed until, we finished treatment. And I think, well, okay, so we need to back up a minute and really familiarize ourselves with who is a part of our team and what services are available to you here at the James. You, as a part of your team, there's probably going to be most of these people, and you may interact with them at different times throughout your care. Obviously, there are your physicians, your oncologist, your surgeon, your radiologist, depending on your type of cancer, and also depending on other medical issues that you may have. There may be other physicians as well involved in your care. Physician's assistants and nurse practitioners, these folks work very closely with your primary oncologist, and oftentimes you may see them at the same time that you see your physician or in place of your physician. They communicate very closely with your oncologist and provide a large bulk of care. And also there's nurses. Nurses, it's very important to know who your nurses are, because they are usually the ones who are triaging your questions and your concerns. So when you're calling in and you have a question about a medication, or you're reporting a symptom that is problematic, the nurse is going to be the person who's taking that call and communicating that question or that need with your team. So becoming familiar with who those folks are is important, and they're really good at doing that, at being an active part of your care and providing you with that information. Some folks also may encounter a patient care resource manager. Those are nurses who specifically work with patients who have some complex medical needs. So if you are caring for somebody who needs some additional support at home, maybe they need home care or some medical equipment, or just kind of triaging different types of care, chances are a patient care resource manager is going to be the person arranging that and reaching out to you. Dietitians are a large part of treatment at the James. There are so many changes to diet and to just your ability to eat and what you can eat throughout the cancer journey. And so our dietitians here specialize in oncology and are available for individual appointments and assessments and recommendations for you as well. And social workers are a pretty crucial part of the team as well. And you may not have seen one yet, but every disease line has a social worker, inpatient and outpatient. And so the social workers are available to provide you a range of support. You know, maybe it's providing some additional emotional support, maybe it's linkage to some community resources, helping with some financial needs or some transportation needs. The chances are, if you're having a problem and you're really not sure what to do about it, ask to talk to the outpatient social worker, because if they can't help you, they can likely find out who can. So they're a good person to know that exists. And there's clinical pharmacists all throughout the James. And it's also, if you've got complex medications, they are someone who can provide information on your medications and drug interactions and your treatments. So they're oftentimes behind the scenes, but they're available to you if you have specific questions about your treatments or medication. And of course, there's rehabilitation at any time throughout your care or treatment journey. There may be a time when the person you're caring for needs some physical therapy. Maybe they need home physical therapy, outpatient, or maybe it's a rehab facility. But this is a big part of care. And physical therapists, occupational therapists, and speech therapists exist to provide that assessment and recommendation for what you may need. These are some of the additional departments that are available to you at the James. And these are ones that I oftentimes hear like, I didn't know about those things. Well, we're going to talk about them. A referral is needed for all of these services, but we have a survivorship clinic. As a cancer, when you're diagnosed with cancer, you remain a survivor at the time of diagnosis all throughout your life. And so this clinic specifically addresses the needs that cancer survivors have. It looks at patients from a whole person-centered perspective. So it's not looking at specifically the treatments that you're getting, but maybe all of the other things that you're experiencing as a result of going through treatments. Maybe it's, you need some physical therapy. Maybe it's that you need some emotional support. In this clinic, there's massage therapy, there are dietitians, a social worker to work with you, and there's a nurse practitioner who's doing those assessments and making recommendations appropriately. There's also the palliative care clinic. And I think this one gets confused sometimes with hospice, because you think of palliative and hospice and comfort care as the same thing. It's not. The main difference is that palliative care is a type of service that you can access at any point in the cancer journey. It is focused on experts in symptom management, and it's looking at the things that you may be experiencing as a result of your cancer treatments, or maybe just the type of cancer that you have, and really focused on alleviating the burden of some of those symptoms that you may be experiencing. And so palliative care clinic is a great resource if you're having some distressing physical symptoms. And psychosocial oncology, we talked a little bit about that. Again, it's the department that provides counseling and psychotherapy to cancer patients and their families. And so if you feel like you could benefit from some additional professional help and support, certainly talk with your team, and a referral can be made for that as well. There's also art and music therapy. I didn't mention that they are a part of Survivorship Clinic, but they are. So art and music therapy are services that are provided inpatient as well as outpatient through the Survivorship Clinic. And art therapy, you don't have to be artistic to engage in it, or to, feel like you have to be, artistically inclined. It's really another way to process and express the impact that cancer is having on your life. And some people really respond really well to that type of expression, as opposed to kind of just talk therapy and getting that support. Music therapy also assists with that emotional coping, but in addition can also help with some physical symptoms. There are interventions geared toward symptoms like sleep problems or neuropathy or pain. So we have a skilled music therapist who can work with you on an outpatient level and inpatient if you're there with some of those things. And we also have a chaplaincy department. So when we talked about spirituality being a big component of coping and nurturing, or if you're struggling with that, our chaplaincy department is full of trained chaplains who can provide some support and some guidance and listening ear to help you kind of nurture and work through some of those larger questions that you may be facing. And there's James Care for Life. Hopefully all of you are familiar with James Care for Life since you're here today. But pay attention. Those classes and support programs change every quarter. And there are educational programs and mind, body, and spirit programs. There are support groups available through James Care for Life, and nutrition programs and exercise programs. And these are things that are free and that are open to anybody, to cancer patients and their families. There's also specific family programs geared towards families with children. And so I encourage you to continue to utilize James Care for Life as well. There's James Financial Counselors. We talked a lot about how insurance questions can be very overwhelming. Debt, how often does illness create overwhelming amounts of financial problems and debt? And our James Financial Counselors exist to help guide you through maybe understanding your insurance plan, your benefits. Also, they help with recognizing financial need and maybe linking you with some resources to help with that need, and help you apply for benefits for the underinsured or uninsured. So they're available to you, and you can call them directly, or you can also have a social worker kind of guide you through that process as well. We also have a patient education department, and this department is really responsible for putting out information, resources, and educational videos that are easy to understand about many different topics that you may encounter throughout the cancer journey. So on that website, you can pull up their website and you can just search by topic. You can just browse what's going on, what all they have on there, but they have their wealth of information that I would encourage you to check out as well. So another just practical tip is, in the role of a caregiver, you're oftentimes the ones that are responsible for getting all the information, for organizing it all. So it's important that you're seeking advice and information and equipping yourself with the things that you need to know when cancer is in your life. The more you know, the more in control you can feel. And when you're dealing with cancer, everything feels like it's out of like you've lost control. So ways to regain some of that control is to fill yourself up with all the information that you can. And your treatment team should really be the front lines of that information. All of those folks that we identified earlier, they're all experts in different things, and I encourage you to utilize them to really think about the questions that you have ahead of time and make sure that your questions are answered when you're coming out of medical appointments. There's also the Library of Health Information. That's in the university hospital's 5th floor atrium. They have trained librarians there who can kind of help you search for information that you're looking for, so you can access them as well. Patient education materials, and of course there's also trusted cancer websites. There's a lot of information on the internet, so pay attention to the sources that you're looking at. There's good information and there's bad information and there's wrong information. So it's important that the websites that you're going to are evidence-based, check the sources, check how the last time they've been updated, just some things to keep in mind as you're navigating the internet. And the American Cancer Society has a patient navigator program. This is a super great resource. You call up that number, you get linked to somebody who is providing you individualized support. So whatever questions you have, they can link you to programs and resources that are local, to support groups that are local, and also address some of those other practical needs, the financial assistance, medication, home health care, insurance, transportation, and other things. And again, we talked about some of those websites. Finding information then about caregiving. So it's programs like this, looking for caregiving programs with James Care for Life. Also, your James social worker is a good resource. If you're having a problem that relates to caregiving or with your family, and you need some more support, connect with who the social worker is. They can provide you with some information and support with that. And then there's also some national caregiving websites that have a lot of good information. American Cancer Society has a wealth of stuff on there about caregiving, about how to talk to your family, about how to talk to children, just what you need to know. A lot of tip sheets on that website, as well as the other caregiver websites as well. So I want to briefly talk about communication. Communication is super important throughout this process. And part of that is that studies are showing us that, healthy communication between caregivers and families are also resulting in positive outcomes with patients' health and well-being and treatment care. Family and caregivers tend to be involved in decision-making at every stage of the journey. And having open and honest, frequent communication is essential, that you're understanding the needs and the wishes of the person that you're caring for, and that you're able to communicate that well with the healthcare team. So it's important with the healthcare team. It's also an important way of helping you guys cope as a couple or a family or a unit. It can really has the opportunity to, when you're communicating well, to strengthen relationships and the bond that you may have with one another. So just some quick communication tips. Using I statements. Sounds simple, but oftentimes we forget to do it. And, beginning statements with I is owning your feelings and owning your thoughts. And so it's reducing the impact or the chances of the person you're talking to becoming defensive. So it's I feel frustrated rather than you make me frustrated. Or I feel frustrated when you don't share appointment updates with me because I worry that you're hiding something. So it's really all in how you're phrasing something and speaking honestly and openly from your own experience. And there's lots of difficult topics that arise within relationships. throughout the cancer journey. And so when you're thinking about something major that you need to discuss, pay attention to the timing and the setting. Don't pick the time of day when you're the most stressed after the kids are in bed and you've had a stressful day and then you finally sit down. That's probably not the greatest time to address a difficult topic. So pay attention to that, when you're thinking clearly, and when the person that you want to talk to is also thinking clearly and in a reasonable mood. Stay on topic. Try not to bring up old problems, or not even old problems, but other problems that exist. And it's important to rehearse, to clarify, and to think about what it is that you want to say, what you want to accomplish, and practice. The more you practice it, the easier it is to communicate in those navigate those difficult topics. It's also really important that, just as you're communicating your needs and your thoughts, that you're also practicing active listening, that you're making good eye contact, that you're letting somebody finish what they're saying before responding. And it's also important that, you're kind of paraphrasing or repeating back what you think you're hearing, so that you're not making assumptions on what you heard. It may be, so what I hear you saying is, blah, blah, blah. It's important that you're checking in with that person, so that you're on the same page and that that you're on the same page. So we're shifting gears a little bit, looking at the importance of organizational skills. That's part of that problem solving that we talked about, is helping reduce stress, is also, staying organized. And there's lots of reasons that as a caregiver, you need to be organized, whether that's medical appointments, it's insurance statements, it's, the managing the other needs of the kids, medications, lots of things that crop up. So the American Cancer Society has a personal health manager kit. And if you call that phone number, they'll send one to your house. What it is it's a folder, and it's broken down into tabs of the big things that you may need to organize as you go through the cancer journey. And it doesn't really matter what system you have in place for organizing. It's just important that you have one. If you are someone who relies on technology, there are a ton of apps out there that can make your life a little bit easier, and always have it with you on your phone. aplaceformom.com there's that link there, has a senior living blog that breaks down the 10 best apps for caregivers, and it gives reviews of all of them, so you can kind of look at what might work for you. Even if you just Google, cancer organizing app, lots will come up. So there's a lot out there if you are someone who's tech savvy. And then also OSU MyChart is a good way to communicate with your team and to organize, things, but with checking lab results or communicating non-urgent needs with your healthcare team. There are also online communities, and these can be a really important way to communicate and to kind of engage your support community. Lots of times people want to help, but they don't really know how, and sometimes we have a difficult time asking for the help. Well, this is sort of like creating a Facebook page community for your cancer journey, and helps you organize. Examples are My Cancer Circle, lots of helping hands, and caringbridge.org. And they're free and they're private, and they allow you to post updates so that you're not having to repeat the same conversation with 10 different people. You choose who can be a part of these communities, and they can go on and take a look at the latest update. They all have calendars, and you can put in there some of your needs. Maybe it's Tuesday and Thursday, you need help with someone taking your loved one to a medical appointment. Well, people who are logged on can see that and then say, oh, I have Thursday free, I'll go ahead and do that. So it's a nice way, it's a nice tool to use to kind of enlist the people and the support that are in your life. Also want to talk a little bit about advanced directives. Chances are you've been asked about them if you're a patient here at the James, and sometimes they freak people out because they think, well, if I'm talking about advanced directives, then, I'm planning for the worst case scenario and it's going to happen. Well, that's not really the case at all. What advanced directives are legal documents that allow somebody to make decisions about their care if and only if they were in a state where they were unable to do that. So as a caregiver, it's really important that you're having these conversations with the person that you're caring for so that you know what that person's wishes are, what types of treatments they would want or wouldn't want. It's important because it can be an added stressor and create a lot of problems if you are in that state and you haven't had that discussion and you're unsure of your loved one's wishes. And it gives people control, right? That you've thought about it and you've made some plans as to how you would want to be treated. And it can create a peace of mind knowing that your wishes are known. So I thought about it, and now I can focus on my treatments and getting well because we've dealt with that. When to fill them out. This is a big one. It's important not to wait for a crisis to address these things. You want to fill these forms out when you're healthy and of sound mind, because that's when you can really kind of process and talk about the treatments and why you would or wouldn't want them. And our social workers here at the hospital are trained in the advanced directives and can meet with you and can explain them to you and help you complete them while you're here. It just requires 2 witnesses to sign the documents, and we can update those at any time. And these are updated all the time. Sometimes people fill them out, and maybe who they want to make decisions has changed. So we just update that. But it's important that everybody who's providing care to you has a copy of that and that you're keeping them in a safe and easily accessible area that you can retrieve when you need it. So moving on to how you find support for yourself. We talked a lot about James Care for Life and the programs that are provided. There is a James Care for Life Hope program coming soon, which is helping others through peer experience. It's a peer-to-peer matching program. And so this is a great program that will match a cancer patient to a cancer patient and a caregiver to a caregiver. And it's a one-on-one relationship. So look for that. That's going to be coming very, very soon. Support groups. So we have in-person support groups. All of our support groups are open to cancer patients, and their caregivers are also welcome to be a part of those groups as well. But there are also caregiver-specific support groups. If you're looking for something on your own, there are telephone support groups and online support groups through cancercare.org, so you can kind of connect with that. There's also some good caregiving webinars and information on that site too. And James has an online community that's a little bit kind of like Facebook in a way, where you can link in to cancer types or specifically the James and communicate with other people and get some support in that way too. And that's cancerconnect.com. And we also have support for families, teens, and children. So if you are experiencing or looking for support for children in your life, James Care for Life has a section that is focused on supporting families. And James social workers are also a great resource to providing you some information and some support, maybe just some practical tailored interventions that you may be looking for. Camp Kesem at OSU. This is also a 2-week-long summer camp for children ages 6 to 16 who have a parent with cancer. And their mission is to support children through and beyond their parents' cancer with innovative, fun-filled programs that foster a lasting community. So that goes on this summer, and if that's something that you feel like your children could benefit from, I would call that phone number. It's also on the website, and you can get more information about it that way too. And there are a lot of information and tips on how to talk with your children, how to deal with the changes within your family through these websites as well, through the American Cancer Society, the National Cancer Institute, and Cancer Care. There's a lot of stuff on there. I encourage you to use those websites. So lastly, we recognize that this is a really, really tough role, that there are so many challenges along the way, and you are such a vital part of the care that is provided to your patient, to the person that you're caring for. And, I just want you all to know that your needs matter, and it's important to pay attention to what your needs are to best support yourself in your role as a caregiver. You may or may not have seen this before. It's the Caregivers Bill of Rights. And I'm not going to go through it all, but I'd like for you just to kind of browse through it and maybe look at it a little bit later. But these are things that you have the right to get the support and to get the care that you need.